And I quite agree, Representative Davis. And would you agree this is especially important for Texas because Texas continues to lead the nation in both the number of uninsured and the percentage of uninsured?
That's correct. And that's what's disappointing because we say we're the #1 state and we're willing to leave our communities behind, other communities behind. I would hate to think that we have to all be on some level of drugs before we can provide health care. We have done mental health care because we see the need. We've done these other kinds of programs because we see a need. What is the most basic need? It's all those that are left behind. Why wouldn't we want to cover them? So again, this is an opportunity for Texas to show up and say they're committed to the citizens of this state, whether they're poor, whether they're mentally, whether they're handy, whatever, to provide health care for them. This opportunity exists today. And I will tell members, this is not partisan. This is not partisan. This is people who in all walks of life who deserve health care.
And Representative, I'm glad you made that point, because isn't it true that, as Representative Reynolds said, 40 other states now have expanded Medicaid, and many of those are either completely red or completely Republican-controlled states, or a mixture of Republican and Democrat control. Isn't that correct?
That's
They've made
correct.
the decision to do that for their people?
That's correct. And you know, let me just mention that when we've discussed any other health care, we hadn't talked about whether it was the red communities or the blue communities. We talked about citizens needing health care because of issues that are going on with them. Right. This is the same notion here. It's not whether they're Texans who need health care. And that's what we should be providing. We have an opportunity. We have resources available. And most of all, we can help our healthcare facilities. That infusion of cash would be great for them because they're going to see these patients in the emergency rooms. And that care is much more expensive than any other care.
And Representative Davis, isn't it correct that if your amendment passes, the Texans we will be helping the most, in fact, are working Texans who simply don't have health insurance through their jobs for whatever reason, but don't qualify for our existing Medicaid program. So they're caught in this sort of black hole where they just can't get insurance under the existing options. Your amendment would give them a new option to get health care. Is that right?
That is correct. And that's what this amendment is about, is taking care of Texans and doing it in a way that we don't leave anybody behind. To the extent that we can do this and we can take care of 4 million people, we get money to take care of them, why are we hesitating to do that? I can tell you that if this was on any other initiative, if it was transportation, we'd take the money. We would take the money. How can we not take the money for health care?